The dark truth. How Dr. Burnout is killing patients. The unseen toll. How physician exhaustion affects your healthcare. Dive into the heart of a critical issue that's often swept under the rug. The impact of Dr. Burnout on patient care. It's a story that affects us all, yet remains largely untold. Imagine this. Nearly 1 in 4 medical professionals clock in over 48 hours a week, with the number soaring to half for those in surgical specialties. These staggering statistics, unveiled by the Medical Council, paint a grim picture of the healthcare landscape. But here's where it gets controversial. How does this relentless work schedule trickle down to affect the quality of care you receive? Join us as we unravel this complex web with Jancy Cotter, the Executive Director for Regulatory Policy, Standards and Research, who shared his insights on News Talk Breakfast. Listen to the episode to gain a deeper understanding of the issue. And this is the part most people miss. The subtle yet significant ways in which physician burnout can alter the course of your treatment. Subscribe to our podcast for more enlightening discussions. Share this article to spark a conversation. It's time to shed light on the unseen heroes of healthcare and the challenges they face. Let's not forget, the well-being of our doctors is intricately linked to our own health outcomes. Read more about News Talk Breakfast, where we delve into the stories that matter. Explore related episodes that offer a comprehensive view of the healthcare sector, from the future of the Gardaí to the potential of modular homes in alleviating the housing crisis. But what about the elephant in the room? The impact of Dr. Burnout. We invite you to ponder this question and share your thoughts. Do you believe the healthcare system is doing enough to support its medical staff? Or is it time for a radical overhaul? Let us know in the comments below. 25% of doctors work over 48 hours a week, unpacking the Medical Council's shocking report. A striking revelation has emerged. Nearly 25% of physicians are clocking in over 48 hours each week, as highlighted in a recent report from the Medical Council. This finding raises significant concerns about the workload and well-being of healthcare professionals. The Medical Workforce Intelligence Report 2024 indicates that those in surgical fields, as well as obstetrics and gynecology, are particularly prone to exceeding this threshold of hours. Notably, around 45% of the doctors who reported working more than 48 hours a week are directly involved in patient care, which underscores the intense demands placed on these professionals. Moreover, the report reveals that approximately 26.1% of doctors face challenges in delivering adequate care to patients at least once a week, while over 1/3, specifically 33.6%, claim they never encounter such difficulties. This disparity raises questions about the systemic pressures within the healthcare system. A staggering 73.0% of respondents identified pressure on workloads as the primary obstacle to providing sufficient patient care on a regular basis. This statistic highlights a critical issue that many in the medical field are grappling with. In 2024, the report documented a total of 20,962 clinically active doctors in the state, with 78.8% maintaining their registration with the Medical Council from the previous year. The average age of these doctors is 43.7 years, with more than 20% being 55 years or older. The gender distribution among doctors shows that over 11,000 are male, 52.8%, and more than 9,900 are female, 47.2%. Almost half of the medical professionals are engaged in general practice, 25.9%, and internal medicine, 23.4%, while surgery accounts for 11.9% of the active workforce. Geographically, nearly 8,990 doctors are located in Dublin, making up 4. The report also highlights that 27.8% of doctors hold an international basic medical qualification from outside Ireland, the EU and the UK. marking an increase from 25.7% in 2023 and 23.3% in 2022. Notably, almost 40% of these internationally qualified doctors obtained their degrees from Pakistan, while 21.3% are from Sudan. Dr. Maria O'Kane, this situation raises critical questions. Are we doing enough to support our healthcare providers? What measures can be taken to alleviate the pressures they face? Join the conversation and share your thoughts in the comments below. Burnout alert. 1 in 4 doctors work over 48 hours a week. Is patient care at risk? Imagine a world where nearly 1 in 4 doctors are pushing themselves beyond the recommended limits, working over 48 hours a week. This isn't just a statistic. It's a reality that has significant implications for patient care and the mental health of healthcare professionals. According to recent research from the Medical Council of Ireland, almost 3/4 of doctors cite pressure on workloads as the biggest hurdle they face when trying to provide adequate care to their patients at least once a week or more frequently. Specifically, 23.1% of doctors are averaging more than 48 hours of work per week, which exceeds the guidelines set by the European Working Time Directive, EWTD. This data comes from a comprehensive study conducted by the Medical Council, where doctors were queried about their working hours, patient care, and future career aspirations. Surprisingly, some of the highest rates of extended working hours were found in surgery, 50.9%, and obstetrics and gynecology, 34.9%. Among those working longer than 48 hours weekly, nearly half, 45.6%, were also providing direct patient care for more than 48 hours each week. The impact of these long hours is evident in the struggles many doctors face. Just over 1/4, 26.1%, of doctors reported having difficulty providing sufficient care at least once a week, while a bit more than 1/3, 33.6%, never experienced such difficulties. However, the overwhelming majority, almost 3/4, 73%, pointed to workload pressure as the primary reason for these challenges. Other significant barriers mentioned by doctors included bureaucratic tasks, 55.1%, and delays in care provision, 46.1%. These issues collectively paint a picture of a healthcare system under immense strain. Beyond these findings, the Medical Workforce Intelligence Report delves deeper into the overall landscape of the Irish medical workforce, with a particular focus on NCHDs and GPs. Some key takeaways from the report include: in 2024, there were 20,962 clinically active doctors practicing in the Republic of Ireland, representing 78.8% of those still on the Medical Council register. The average age of these doctors was 43.7, with around 1/5, 20.6%, being 55 or older, nearing retirement age. More than half, 50.3%, of these doctors were specialists, while 30.8% were general practitioners. General practice and medicine had the highest concentrations of clinicians, accounting for 25.9% and 23.4% respectively. Surgery came in third with 11.9%. Interestingly, a growing number of doctors, 27.8%, hold international qualifications, a trend that has been rising steadily. Pakistan was the leading source of these qualifications, representing 39.7% of the international graduate pool, followed by Sudan at 21.3%. Moreover, more than 17% of doctors expressed a likelihood of reducing their clinical hours, indicating that managing work-life balance is a significant consideration for many. Commenting on the findings, Jansi Cotter of the Medical Council emphasized the importance of addressing these issues to ensure optimal patient care and workforce sustainability. She noted that while Ireland is renowned for its medical training standards, retaining doctors trained domestically remains a challenge. Cotter highlighted the need for collaboration among organisations to leverage data and resources effectively. Dr. Maria O'Kane, CEO of the Medical Council, echoed these sentiments, stressing the organisation's proactive approach to supporting the expanding medical workforce. She acknowledged the surge in doctor registrations, but pointed out that only 20,692 were actively practicing in Ireland as of 2024. Dr. Bernadette Rock, head of Research and Regulatory Data Insights, underscored the value of doctors' feedback in shaping a sustainable healthcare system. She thanked the medical community for their contributions, emphasizing the importance of their insights in promoting patient safety and ensuring a well-supported workforce. This research not only highlights the current state of the medical workforce, but also underscores the urgent need for strategic investments in training, recruitment, and retention. As the healthcare landscape continues to evolve, understanding these challenges will be crucial in addressing the pressing needs of both patients and providers.